So today we are going to have five practice for communication station. And I believe that I actually focusing more on the consultation station instead of communication. But I thought it would be nice if we also do one or two or three session of communication session throughout the journey of preparation. So before I let the first candidate to start, I just want to have a short briefing. So as we all know, the new format, station 1 and 4 is the one that uh, has the com skill, in which you get 5 minutes to prepare outside and then 8 minutes of communication, followed by addressing the concern in the last 2 minutes. So there won't be any YY as compared to the old format. And generally after that, immediately you will go to the short case station, either RESPI or APTO. Okay, so the marking sheet is as such. I won't go through in detail, but you can see that generally we really need to score the com skill in order to pass both communication component as well as concern. Okay, if you fail one of the station, but you do well in your clinical consultation, you are still possible to pass. But it's quite risky even if you fail one. So ideally, if possible, com skill you should get full marks. Okay. So what kind of scenario that can come out in exam is I want to go through this because I have a more detailed presentation on communication skill in the YouTube channel, but I just want to go through this just to refresh everyone on the understanding of what type of cases you're expected to know. So listed here are all the 11 possible scenario in terms of different teams, and the one that I put in bold for the first 7, 2, 4, 6, first 8 scenario. First six scenario would be the one that is very important for us to know how to do, regardless of what kind of scenario. The team are usually evolve within this scope of the teams. Okay, so first, perhaps the important thing is you must know how to explain a disease and decide that whether you want to break the disease as a form of bad news, or you just want to explain the disease. Okay, and then the second possible scenario is that whether how do you explain a procedure or a medication to initiate, and also to also ask about consent. Consent is very important. Let's say procedure, you are asking of consent, whether or not patient agreeable for not. I mean just a verbal consent, but following after you can say I'll offer the list of legal documents, all the things for you to sign. You can think through first, and then you have any question can come back to me. Something like that. Medication generally you just need a verbal consent. Okay. And the third possibility is the explaining complication for any procedure or medication. Okay. So this is generally important. You need to know a little bit of the information regarding what kind of procedure or medication, and you need to differentiate very clearly that this is a complication, this is not a medical error, or this is not something uh, because of the malpractice or anything. It's just a complication that's expected. Okay, so the fourth scenario perhaps is common, is the medical error and also incident reporting. The fifth one would be the advanced directive, lasting power attorney or advanced care planning. So it tested us on the understanding of end of life care, patient autonomy, as well as which one to follow. Okay, the sixth one is actually the angry surrogate, in which you need to be prepared. Sometimes you know that the scenario is going to be the angry surrogate. You really need to be calm, and then it can be from the patient or next of kin. But the idea is you need to be calm, and then you need to be professional, and then try not to rush into getting your point. Just try to listen more other than try to argue back. And perhaps the seventh one is the refusal of procedure, medication, or even admission. Admission perhaps is the one more common nowadays, which is a discharge against medical advice, or AOR as we call it. So we need to know, we should respect the patient after understanding their idea, after explaining the risks, the benefit, and then another thing is that we need to review, if let's say patient really wants against medical advice and discharge, what would be your safety net and what is your plan? What are the things that you can try to negotiate to the common ground? That's the important thing, instead of try to convince patient to stay. Okay. And the eighth one, which is possible but less common, is the genetic testing. Following the last three is quite rare, I would say. And if those taking MRCP Island is generally even rarer to get this kind of scenario, because you only got 6 minutes for Island so you won't have much time for that. However, for MRCP UK, so any form of scenario is possible, like I mentioned, listed in these 11 teams. So you briefly need to know how to talk about brainstem death and how to mention about organ donation and transplant counseling. All that actually, I think we discussed before in our previous recording. You all can actually have a look through later on. And then postmortem is also important. We need to differentiate what is hospital and coroner postmortem. And the last one perhaps is the one very rare I only encounter during my mock exam, not the actual exam, is the clinical trial recruitment. A little bit on how to recruit the patient and also talk about what is like, for example, what are the benefit and also what are the things that need to watch out for. So all these things need to be practiced. All these 11 teams, if you can practice the first 8 teams, that will be very good. You will be almost considered prepared. But at the same time, you need to prepare for the unexpected one, which is the rarer one. Sometimes can come out in the exam as well. So generally today I got 5 scenario, and these 5 scenario tested on 5 out of these 11 teams. And regardless of what kind of situation or scenario, generally the principle is still the same. I will explain to you why later on. So with that, I will go through the first candidate. First candidate, for I understand, is Dr. Chris, right? Are you there, Dr. Chris?
Hi, yeah, I'm here, I'm here.
Yeah, yeah, I can hear your voice clear. So are you ready to practice as a first candidate?
Yes.
Okay, so I will start the timing now. So you got I will give you 4 minutes instead of 5 minutes as usual. This is our kind of like our simple rules here, because 1 minute is just to make sure that sometimes you shift this from one station to another, so you may not have that 1 minute. So it's important for to tune yourself for exam with a shorter time. So I will give you 4 minutes. So the 4 minutes will start now.
Okay.
Okay, time's out. Dr. Chris, this is the patient daughter, Madam Rose. You can start now.
Hi, good evening. I'm Dr. Tay. I'm a doctor in the neurology ward. May I confirm, is this Madam Rose?
Yeah, yeah, I'm Rose.
Hi, I'm here to explain to you regarding the situation of Mr. David. Um, Before I proceed, may I ask how much do you know about Mr. David's illness?
Yeah, my father was very unwell. I was told that he was doing the MRI of the brain to diagnose the some Parkinson disease condition, and then suddenly I received a call while having dinner that he cannot lie down still and have to give some medication to put him into ease. Then suddenly during the procedure, apparently something happened, doctor. So that's why you all call me to come to hospital. I immediately come. I don't know what happened, doctor.
Okay, thank you for telling me all this. Your explanation is correct. First of all, uh, I would like to tell you some bad news.
Huh? What bad news, doctor?
Okay. Um, I would like to apologize in advance. During the procedure of MRI scan, because your father is a little bit restless, so we have to give some medication to make him a little bit sleepy in order for us to proceed with the MRI scan. The
Okay.
medication that we are going to give is called midazolam.
Mm-hmm.
Usually we give in a very low dose and slowly giving lah. However, uh, in that situation, the medication was wrongly given at 10 milligram instead of 2 milligram.
Oh no,
So
you mean the medication was given 5 times higher than the initial supposedly given dose?
yes, you are right, and I apologize. I'm very sorry for this thing that has happened to your father.
Oh my gosh, how can this happen, doctor? Why the doctor give this sedation medication to my father?
I understand the concern. This we will have a discussion with the doctor in charge during the day. We'll carry out an incident report and also a meeting together with the whole team to find out exactly what has happened in that situation, and we'll get back to you once we have the conclusion.
Doctor, I want to know who is the one that do this. Who is the doctor that give the sedation medication? Can you tell me, doctor? I really want to know who.
Okay, I'm sorry that I cannot disclose the name of the doctor to you because
Okay.
the doctor, we work as a whole team, and it's not one person's error; it's a team's effort. So I would like to apologize on behalf of him.
No, no, I don't accept this apology. I want to complain. I want to sue the doctor in charge. How do I complain, doctor? I'm really unhappy about this.
Okay, sure. We'll gladly help you with the complaint with the procedure of complaint. This one will refer you to our patient advice and liaison service (PLS). They will help to they will guide you on how to proceed with the complaint in this with regard of this matter. Is it
Okay.
okay for you?
Yeah, yeah, yeah. I definitely will complain, doctor. I'm
Okay.
very unhappy. What happened to my father now, doctor?
Okay. Okay. After the midazolam has been given on at a higher than normal dose, unfortunately, your father has a drop in his consciousness. So, because of drop in his consciousness, he has difficulty in breathing. So we have to put in a tube into his mouth. We call it intubation, and using a machine to help him to breathe. This is what we call intubation. Then we have given a reversal medication that we call this is an antidote for the midazolam to giving to him already. After given the antidote, fortunately, Mr. David has regained his consciousness and his vital sign is now normal. We have already put him into our ward for closer monitoring, and especially we'll monitor his consciousness and also blood pressure and also the heart rate closely. If anything happen, we will definitely inform you and we will resuscitate your father as needed. But
Doctor, what are the potential harms from this event? I can see that he is lacking of oxygen during that period of time. Does it carry any long-term harm to his brain? His brain is already damaged, doctor. We are suspecting Parkinson.
Okay, and in this moment, he has already regained full consciousness. I believe there's no damage to his brain because of this scenario, because of this problem. So, in this medication, if given a higher than normal dose, it has potentially cause a low blood pressure, and then leading to a low drop in the consciousness, as well as uh, oxygenation also will be affected as well.
Sorry, what is oxygenation, doctor?
Oh, sorry. The oxygen level in the body will be decreased as well.
So does it mean that
So,
my father brain is lack of oxygen and that may carry serious complication, doctor? I'm very worried lah.
okay, in this actually we have already immediately resuscitated him, and we have carried out the procedure of intubation uh, to him, and then given the reversal medication, given antidote for him already. So your father has already regained his consciousness, and he is able to communicate with us now. So of course, I understand your concern. We will closely monitor his consciousness. If his consciousness is still not normal, we will proceed with the brain scan to look for any what you call that any damage in the brain caused by this low oxygen problem. Is it okay for you, Madam Rose?
Yeah, I'm okay with what you're all doing now, but I'm still unhappy, doctor. How can this happen to my father? You see, he's old already, he's 50 years old. He's very precious to all of us, you see.
I understand, Madam Rose. I'm sure you are a very caring doctor. Uh, I would like to apologize again on behalf of my team, because I admit this is a serious mistake. This shouldn't be happen. This shouldn't be happen. We will definitely carry out a meeting and file a incident report, and we'll have a meeting with the person that involved in this problem. And then once we got a conclusion, we will get back to you.
Okay,
Is
you have
it
mentioned
okay?
that you're going to observe my father and make sure he's okay. But what about the Parkinson thing? Is he going to be lifelong, becoming worse in terms of his symptom later on?
Um, this Parkinson disease, the diagnosis is not confirmed yet. We'll after he's stable, we'll do an MRI scan, and then to confirm that diagnosis.
Oh
Of
no,
course,
you
at
are
this
going to
moment,
do the MRI brain again?
uh, yeah, because just now the procedure was unable to complete because of your father has been intubated.
2 minutes left.
Okay.
Okay, but I'm very scared of that. I don't want to do this anymore. I don't want to subject my father for this scan. Does this scan really necessary, doctor? I don't want lah.
Madam Rose, I understand your concern. In our opinion, this scan is very vital in diagnosing your father, in letting us know what exactly happened to your father. Without this scan, it might be difficult for us to reach to the final diagnosis. And we will promise you, in this coming scan, we will definitely closely monitor and give the correct dose of the sedation before the procedure start. Is it
Okay.
okay? Madam
Yeah,
Rose, do you have
but
any
but when,
concern?
yeah,
Yeah.
but when are you all going to do the scan?
Once Mr. David has become more stable, maybe in 1 or 2 days' time, we will proceed with the MRI scan.
Okay, doctor.
Okay. Madam Rose, do you have any concern?
Yeah, I'm concerning because I'm the one that taking care of my father. If anything happens, I don't know what to do, doctor.
Okay. May I ask? How's your mother? Your Mr. David's wife?
Yeah, my mother already passed away 2 years back. I'm just living with my father, and my father is having a lot of disability now. I'm working alone, and I don't have I don't have time to take care of him. I'm very worried, doctor.
Oh, I'm sorry to hear that. I'm sure it must be a very difficult scenario for you. Don't worry. We'll try to sort out this problem. We will refer you to social welfare to give you some financial helps. and perhaps a social work and may have some hospice care may be needed as well.
Sorry, what hospice care is this, doctor?
Sorry.
Time,
Uh,
time's up,
I
time's up, time's up.
okay.
Okay, right. Let's stop it.
I think
Okay,
I covered
so
the whole thing.
how do you think about your performance for this scenario?
Uh, I think I'm not empathy enough. Yeah.
Mm-hmm. Okay, anything else that you think perhaps if you do the same scenario again, you can try to make it better?
Um, Try to avoid jargon like oxygenation. Just now I wrongly used the term jargon.
Mm, mm. I think my comment to you is there's a few like so first is actually before you, because I say this is Madam Rose, right? You can start now, right? Something like that. Usually the examiner will introduce a surrogate to you and by addressing the name. So but it's important for you to actually establish the relationship with the patient and the surrogate. Meaning to say that, may I confirm that you are Madam Rose, you are Mr. David daughter? Because you actually didn't confirm about the relationship, but you straight away jump that, okay, today we're gonna talk about Mr. David condition. Before I begin, what do you understand? It's like very template thing. I mean, we all generally use this as a starting words, but try to modify it a bit, and you need to really establish that you're talking to the correct person lah, because you didn't do that. This is the number one. Number two is, I feel perhaps the way you feel, I mean, you commented yourself that you feel yourself is not empathic enough. Perhaps in this situation, I feel like you should lower down your voice a bit. I mean, make it very empathetic, and then try to talk softly instead of using your normal tone. Sometimes in exam, it's also important to focus on your soft skill, in which you should learn how to raise up your voice a bit or lower down your voice a bit and then make it softer. So it all matters, because depending on different types of scenario that you encounter, when you're preparing this scenario outside, what are the things that you expected?
I expect she will ask how to complain. I expect she will ask how is a solution to this problem in the future and the present.
Okay, so you if you go to the list of themes that we discussed just now, which themes that this scenario falls into?
This is medical error.
Medical error and plus or minus angry surrogate, right?
Yeah.
Yeah, so you need to anticipate that this can be potentially angry surrogate. So you need to be prepared for it. Okay. So it's important for you to learn from each scenario. And then when you look at outside, what are the things that you are expected. So you should, I mean, your opening sentence is fine in the sense that you try to elicit what did the doctor understand about the condition. And then subsequently when you explain, yeah, I would say that you don't have to tell midazolam 10 mg or 2 mg things. Perhaps you can make it simpler for the daughter to understand, is that the medication is called sedation, is usually given in a lower dose and step up gradually. However, in this case, the doctor in charge accidentally gave, unfortunately, 5 times the dose that's supposed to be given. I'm very sorry that this thing has happened. So you just pause first. You don't have to busy to explain every situation. You have to pause and react on the emotion. So the idea is not to tell everything at one go, or not to mention a lot of things at one go. Is to really taking a small information one by one. Okay, this is a scenario that you really got enough time, because mainly you just need to address the medical error part. Okay, you also need to stress on. I admit that this is a medical error. I really want to apologize for what has happened, and unfortunately, this error has happened to your father. It can also happen to anyone. Unfortunately, it has happened. So with that, we are deeply apologize for this. And then immediately, what was done, you also need to mention about that instead of waiting the patient to ask. So what's happened after this? So the idea about when a medical error happened, right? I mean, just like in the real life, when there is a error or potentially medical legal issue, the first question the judge probably going to ask is what was done to correct the error, what was done after that. Because the thing that really matters is when the error happened, what are the damage control that was done. So that's the more important thing to stress on, you see. So after you give some time for the surrogate to address a bit of emotion and say, I'm unhappy, want to complain this and that. You apologize again, and you immediately try to stress on that what was done after, and also telling the surrogate that now, uh, fortunately, he have regained his conscious level, his vitals are now stable. However, we will keep a very close eye on him, and we really understand that you will feel frustrated, you will feel very angry for what has happened. Again, you try to be apologetic again. Only then, in this scenario, only then after you mention that because of everything that was happened, we have found an incident reporting. We have also informed our consultant, and we will investigate how does this thing happen and how to prevent it from happening in future, and also to improve our services. You must highlight on all these things slowly, but not immediately at one go. Immediately after, he wants to she or she want to complain, immediately mention about that. Okay, and then you should also try to focus on the damage control and what I mentioned. Like after you mention things that was mentioned in the scenario, that like things that was done, you should also mention about things that is not mentioned. What are the management for this patient? So management, let's say this MRI thing never happened now. So what are the things that for Parkinson, so-called suspected Parkinson plus syndrome, you can offer? A lot of simple things that you can offer is really something that is very common until in exam we don't really routinely mention, is that you can also mention that when he's more stable, we are focusing on rehabilitation, we're focusing on referring him to a neuro rehab team, the occupational therapy, the speech therapies. He may or may not have a bit of speech difficulty, may or may not have some swallowing difficulty. We will address all of that slowly. And at the same time, it's also crucial for us to really confirm our diagnosis. And he may need to be scheduled for another round of MRI. However, please be assured that we would do it very cautiously, and then we will make sure that everything is done properly. You see, so you can preemptively mention about everything already, but try to go one by one slowly. Okay, I think your approach is, I won't say your approach is wrong. I would say that you are almost right in following the template. Perhaps you attended my session before, is it? Or some
Yeah.
form of teaching before. So you know what to do when you encounter things like try to tackle the medical error. But sometimes you don't have to tackle it like word by word and tackle it like just following the mnemonic like A bump, things like that, what I mentioned. So sometimes you need to modify a bit, and then depending on the scenario and depending on how the surrogate respond. So you need to go a bit gentle in this kind of scenario instead of like using your normal tone. You can also imagine that when I try to explain like what if I'm a candidate, I'll try to make my voice softer and also make my voice slower and also pause a bit more. So you need to do that to show the examiner that you really concerned, you really understand that she's frustrated, and you really want to help. And therefore, you are being very professional. Examiner likes to see our change in tone, our gesture, and all those things that we hardly ever focus. And at that point of time during the exam, we will be stressed. My first question to you is perhaps, do you feel stressed when you look at this scenario stem?
Uh, Not really,
How
because
long do you
actually,
take to how long do you take to read the whole scenario?
yeah, about a minute.
About a minute, right? So that's something quite common. Sometimes the communication skill scenario, right, in the real exam, the scenario can be very lengthy. The problem with the scenario is can be lengthy. So that's the reason why I try to make it lengthy a bit so that to give everyone an idea and also preparedness when you encounter any form of scenario. Sometimes you need to give yourself some time to read through a scenario carefully and then try not to be panicked. And because if you read through it's a long scenario, you are panicked already, and then you start to lose yourself, you start to lose all the approach. So your mind can go blind, things like that. So that's the reason I'm practicing this case with you. Okay. So
Okay.
I think you are okay in the sense of you know what to do to approach the medical error, but you just need to modify a bit here and there. You understand?
Okay. Understand.
Yeah. So if I'm going to score you, right, perhaps the communication skill part, unfortunately, you use a bit of jargon. Huh? Some certain examiner will give you borderline, certain will straight away give you unsatisfactory. Bear in mind, but in a real examiner can be very personal in the sense that if you use one jargon, can really give unsatisfactory. It depends on the examiner lah. Because you see, look at the marking sheet, don't have the S behind one. So sometimes they can be very strict on this. Concern, I think okay, you manage to check back the patient concern. Judgment wise, I think okay, it's sensible from the way you mentioned. Welfare part, I think, is still fine. Just that the communication skill part, perhaps you can try to improve a bit. Okay,
Okay.
so and it's also good that the reason why I try to hint on, why the patient still feel stressed despite you are apologizing a few times, is that try to always take some time to explore the social aspect, the dynamics of it. So let's say that so may I know that, for example, because everything has been discussed and then the patient surrogate doesn't seem to have any concern, perhaps the next thing you want to tackle is the social part. So you can ask, so may I know, are you living with your father, and how are you coping? Are you having any issues? You should proactively ask all these questions to try to understand their social background. Sometimes they have people angry for certain reasons, especially if you encounter any angry surrogate kind of scenario, angry station. Most of the time, the hidden agenda is not always due to the scenario per se. Most likely, they have some other hidden agenda that need to be explored. So that's the reason why this scenario is kind of like I mentioned, it's kind of like medical area plus angry station. That's why it's like a mixture of both, huh? So that's why you also need to try to elicit what are the things that the patient is a bit unhappy about, and whether patient I mean whether the surrogate is feel stressed for some other reason, for example. Okay, so discussion, I think you are okay, you know what to do. So for those that hardly or haven't practiced how to break the medical error component one by one, is that this is what I usually tell everyone. The reason why I came up with this mnemonic or some simply mnemonic is because I sometimes I worry when I go inside and I don't know what I should do, because can get very blank our mind. So but don't be worried, if you practice a few times for this kind of scenario, you should be able to get it. Okay. So after you inform your role, confirm the name and the age and also the relationship, and then you tell the surrogate what to do, you must admit and apologize first as a team. The important thing is as a team. That's why what Chris did was correct. He said that it's not one person issue. It's actually whole team is responsible. This is good, and then you should explain that the error is not intentional. It can happen to anyone. Unfortunately, it has happened. Okay, to your father. Another thing is that after that is the incident report, inform consultant, investigate. This one I think everyone is very good in it, and you may need to apologize a few times depending on the type of emotion that the surrogate convey. And then usually at this point of time, patient or surrogate will say he want to complain. So you should also try to elicit this component of autonomy, in which yes, you definitely have a right to complain, but you forgot to mention one thing important, is that you should even direct the surrogate to complain, which is not that wrong. But generally, we try not to focus so much on complaint. You can mention that I can direct you to the appropriate department to complain, but you don't have to mention about patient advisory license services, which is not available in Malaysia. It's basically in UK. House is only in UK lah. But if you don't want to mention that, usually if you take the exam in Malaysia, perhaps you don't have to mention about PALS lah, because Malaysian don't have PALS. But you can mention about complaint department, or appropriate department to complain. But you don't have to mention that direct you, things like that. Your focus is actually try to say that you definitely have all your right to complain, and we can direct you to the appropriate department to do so. But please be assured that we will continue to provide the best management, and your complaint will not affect the management. You should focus on this, in which you didn't in this scenario. Okay. And we should always go by the patient best interest. Okay, and then the R will be the reaction. So what was done, you have mentioned all that as well. Put in the tube to secure the airway, and then reverse the reversal of the overdose of this medication has been given appropriately and timely, and then now that he's becoming stable and responsive well. So you should also focus on, like what I mentioned, is the rehabilitation part. You can mention about all those things, that the multi-disability and things like that, just in the short one. And then you should be assured that again, that the complaint is not the main thing. The most important thing we need to do right now is to make sure that we provide a better care, best care to your father. Okay. And then social issue and concern. You mentioned about the concern, but you don't really dive in the social history. And at the same time, the time is quite short. And I don't know why you suddenly mentioned about hospice at the end of the last 5 seconds.
Suddenly out of word already. I think I mentioned wrongly. Sorry.
Yeah. You so you see, when you get very anxious or when you get very panicky, right? when the moment the surrogate or something asks you back one question, or even you accidentally say out something that's not supposed to be mentioned, you really will lost the station. Okay, this one just ignore it lah, because I didn't change this, something same as a other scenario, basically just to inform regarding the summarize regarding what was happened regarding the incident only lah. Okay, and the hospital contact for updates or further question lah. But you can see that it's important that you should not mention something that is not supposed to mention. Okay, like hospice things like that is something not important at all in this station. If the scenario is something mentioning about patient is like towards advanced care, advanced directive, advanced care pairing or end of life care, then yes, you mention about that. But in this scenario of medical error, you shouldn't mention anything about that. Okay, just be careful on that. So you can see that that's why when you prepare the first 5 minutes, when anything write on your blank piece of paper is important, because you should orientate yourself that okay, this is my framework. Okay, so I'm going to talk about this. So if you follow roughly for what you have written, you will generally be safe and you won't do anything more than that, unless you get a very unexpected question or tricky case lah. But generally, if you got a framework, you will know how to approach it. Okay,
Okay.
so
Okay.
and any question, Chris, before we proceed with the next scenario?
I'm not sure how do I approach to the what I call that, the further plan for, because the just now the daughter was mentioning that she's staying with the father, then she's very stressed. I was thinking
Mm.
like, should I mention about the counselor thing, you know?
I mean, yeah, I mean, counselor perhaps is not the first thing that you should mention. You should mention about social worker. The most important thing in this aspect is the social worker, so that they will assess and see whether or not they can provide some NGO-based service to her, so they can help her hire someone to take care. Okay, so
Okay.
that would be a more important thing lah. But the idea is not to focus on the surrogate per se. It's more to on the care of the patient lah. Unless the scenario is like really hinting towards the surrogate is not is emotionally unstable, got some other issue, probably drug addict or things like that, then probably not safe to take care of patient, then perhaps you can mention something like that. But generally, I don't think RCP will come up with this kind of scenario lah. So far, from what I understand so far, we generally hardly encounter things that targeting really on the surrogate per se, but it's actually mainly focusing more on the patient. Okay.
Okay.
Okay, so
Thank
okay, that's all. Thank you, Dr. Chris. So next will be Hafiz. Hafiz, are you around? Can you unmute yourself? Hafiz? I think I saw him just now in the chat. Hafiz Nazri, right? Hello? Maybe he is. Oh yeah, perhaps this is a prayers time. Perhaps we will proceed with the next.
Hello?
Hello? Yeah, Hafiz, is it? Yeah.
I have
Sorry
problem
for
with
that.
microphone, sorry.
Okay, sure. Are you ready to for a
Uh,
second
yeah,
scenario?
yeah.
Okay,
Okay.
you're
Yeah.
ready, yeah? So I will give you, sorry, so fast. Accidentally, I forgot to put the page. So I'll give you 4 minutes to prepare this scenario. Okay,
Okay.
so when the time's up, I will let you know. Okay, so let's start. Okay, time's up. Dr. Hafiz, this is
Yeah.
the patient, Miss Justina. You can start now.
Hi, I am Dr. Hafiz, medical doctor in hematology ward. Can I confirm this is Miss Justina, 35-year-old?
Yeah, I'm Justina.
Hi, today we would like to have a discussion about your condition. Do you have any idea about your current condition right now?
Yeah, doctor, I've been having a lot of breathlessness, especially when I walk. So I
Okay.
also realized that I have some bruises that is recently occur, and I was told by the doctor that I have some issue in terms of my blood result. So they told me that all my red cell, white cell, and also platelet is all low. That was what I know so far, doctor.
Yes, you are right. So, and we have bad news for you today,
Huh?
but we are planning for further investigation for you. Do you want to know about it more?
Oh, of course I want to know. You just tell me that I have a bad news.
Mm,
What
yeah,
what
yeah.
what am I having, doctor?
So we already analyzed your blood based on the cell count and also under microscope. So like you said, your white blood cell, platelet, red blood cell are all at the low side. And under the microscope, we can see a suspicious cell that, based on our discussion, suspicious of acute myeloid leukemia, a type of blood cancer. Are you
Oh,
following me?
I don't know. Is this leukemia? You mean the leukemia that the people have to go through multiple chemo, that kind of leukemia?
Yes, yes. So acute myeloid leukemia is a type of blood cancer, as we know. Uh, there are there are modalities of like chemotherapy, for example, that but before we determine your direction of treatment, we need to do some procedure. So are you following me?
Yeah, I'm very scared, doctor. Now you're telling me that I have this blood cancer leukemia,
Yes,
and
yes.
And you tell me that you need to confirm the diagnosis by doing something.
Yes. So I understand you are worried, anxious, and what we are doing actually is a procedure to diagnose your cancer and also determine your treatment. So our procedure is what we call bone marrow aspirate and trephine biopsy, which is taking a sample of bone marrow from your head at the back.
Sorry, doctor. What is bone marrow?
Yes, bone marrow is actually in the what is inside your bone, the tissue or inside your bone, which contains the like factory of our cells. So all our cells coming from bone marrow. Then one of the place, the ideal place for this procedure, is, as I said before, is at the hip. So do you have any idea about this procedure?
Mm, I heard people did that and it was very scary and very painful, doctor. But I don't know the details of it. I want to
Mm.
know about it.
Okay. So regarding this procedure, this I would like to assure you that this is a safe procedure where we in hematology ward do it almost every day, and we will do it under supervision of our consultants. And before we do that, we will analyze again your blood count to ensure that the count is adequate for the procedure. For example, we need certain level of platelet in order to prevent, for example, complication of bleeding. And then regarding the procedure itself, you will be lying on your side, and then we will give ample amount of analgesia. So the most common complication is actually pain. We will give analgesia to you from the skin up until the bone marrow. Are you following me?
Oh no, you are going to give the painkiller into my bone?
Uh,
That
Again,
sounds very painful as well, doctor.
okay, I understand you are concerned about it, but as I said, this is a very common procedure. We will use the same needle that is used, for example, for your blood taking, and then we will inject it from the skin until the bone, like you say. It is important because the bone itself is quite irritant, which means that if we do not give enough anesthesia, yes, you may experience pain. We will give the anesthesia, and then we will test whether it is enough for you or not. Are you okay with that?
Okay. Then what is the next thing? I mean, is it just one go thingy? I mean, you just need to poke inside into my bone and then you just take out
Mm.
the sample. Is it all?
Okay, so there is actually two part of it. First, after we inject the anesthesia and then we insert quite a big needle, but with anesthesia, what you will feel is uh, only some kind of pressure. So we will always communicate with you if there is feel any pressure or any discomfort. We will try to minimize the pain. We will aspirate, which means we will take some blood inside the bone marrow itself, and then we will insert some needle to get a chunk of tissue from the bone marrow to analyze it. This we will liaise with our hematopathology lab. Okay.
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 What are the complications that I need to know?
Yes. So the complication, first and foremost, we need to ensure this is the correct site. We will mark the site because sometimes it may shift to joints, for example. It may cause much more pain, and then bleeding, as I said earlier, because you already have bruising or bleeding tendency. So we will ensure that your blood markers are at the level adequate for procedure. And then another issue is also after the procedure itself, we need to ensure that no bruise or bleeding from the side. Do you have any other question regarding the procedure?
Oh, okay. But if I refuse to do this procedure, is there any alternative?
Regarding diagnosis of leukemia, the importance for a spirit and biopsy is for us to send some lab tests regarding molecular side genetic tests.
Oh,
This
why
genetic
why
test is
is that?
very important so that we can see whether you may respond to the chemotherapy or not.
Oh,
So if you have doubts about it, of course I can bring my consultant to explain more and discuss about this with you. But
yeah,
I
but doctor, is there
yeah.
anything else that you can offer if I don't want to go through this procedure?
Okay, for my leukemia, other than the bone marrow aspirate and biopsy, we can also send, like I said, cytogenetic from your
Two
blood.
minutes left.
Uh, this all will determine again our form of treatment for you, and also help us in later monitoring your response to our chemotherapy. So, do you have any other concern, Miss Justina?
Yeah, doctor. If now my first question is that is this really mean that I have leukemia?
Based on what we see in blood count and blood under microscope, it is highly suggestive of that. But our diagnosis is actually not complete because we need to further analyze regarding genetics and all. Do you have any other question?
Okay. Yeah, very scared, doctor. I
Okay.
don't know whether I should do this or not.
So, how are you feeling after hearing all this news?
Yeah, I think I really need to talk to my family members about it, and I will
Yes.
get back to you.
Okay, thank you, Miss Justina, for your cooperation. If you have any question, we always have we can supply you with the pamphlet, brochure, or even video for you to see regarding the procedure itself. Okay, do you want to ask any other question, Miss Justina?
No, no.
Okay, Miss Justina. So, are you? Can I ask a bit about your social history? Are you working, Miss Justina?
Yeah, I work as a
Oh,
promoter.
okay. So actually, our procedure can be done in one day. So you admit, and then after the procedure, you can discharge if you have no complication. So that is something that we can assure you as well.
Oh, okay.
Is it
That's good.
okay?
Yeah.
Okay. Thank you, Mr. Sinha.
Yeah, thank you. Okay, time's up. So, Dr. Hafiz,
Yeah.
how would you think of your performance?
Uh, I think I am not convincing enough for Mr. Sinha to understand regarding the BMAT procedure.
Mm, but sometimes we don't have to be convincing, right? We just have to explain, and then I mean, whether patients say yes or no is their
Mm.
decision, right? But then, what are the pitfalls that you think you have done in this scenario? Is there
Mm.
anything that you feel when you think back, if you is there anything that you can do better if let's say you encounter something similar?
Um,
You feel
um,
okay?
maybe give I think if I read the stem, it is suspicious of pregnancy is not confirmed yet. Is it?
Mm-hmm. So how do you approach when you look at this stem outside, right? So first think back of what we have mentioned just now.
Yes, yes,
Out of the 11 teams, which team that this scenario falls into?
procedure.
Explain about procedure, right? And what is the task again?
Task explain regarding procedure address her concern.
So this is very important thing about exam. So the exam task is asking you to explain about the procedure and address her question.
Mhm.
But the task never mention about explaining the diagnosis, right?
Mhm.
So in this kind of scenario, it's a bit tricky because as a general knowledge, if let's say anything that show blast under the PBF is not equivalent to leukemia, that's the first thing.
Okay.
So and it's a 5% blast. If it's like 20+% blast, you can argue that okay, even if it's not leukemia, it's something that we should tell. But 5% blast doesn't necessarily mean leukemia. It just means immature white cell that can happen for many reasons. Okay.
Okay.
And the point to mention about no acute hemolysis is basically try to tell you that this cannot be APML lah, or else it's something more urgently need to be done other than BMAT. And the stem mentioned that it's suspected to have leukemia, and therefore you need a diagnosis. Again, that is suspected. The keyword is actually suspected. So at this point of time, if you, because you choose to commit and you choose to mention about leukemia and choose to break the bad news to begin with, which is, I feel, a bit dangerous to do that, because if even if you really want to break the bad news, it's not the way you should, what you portray just now to break the bad news. Your first sentence is, Miss Yashina, I have a bad news to tell you, unfortunately. Straight away like that. It's like, wow, first sentence that's like not nice to hear, right?
Okay.
So let's say if really something, let's say this scenario is a bit different, like meaning to say that it's very confirmed to have, it's like very highly suspicious of leukemia, and your job now is to counsel about marrow, and the task is mentioned to explain regarding the diagnosis, meaning is asking you to kind of like breaking the bad news a bit. So how should you break the bad news in, if let's say the scenario asks you to do so? How will you do that? Other than doing what you did just now?
Oh. I'm afraid I don't have good news for you.
Okay. Then
Uh,
should you ever tell that you have leukemia, is it?
mm, I'm not sure.
Yeah. So that there are different ways to do that, lah, depending on how you convey the message. Generally, the way that I do is very tempered, I would say, regardless what kind of scenario that I think this is explain a disease that I need to break the bad news. I will tell the patient that we have done a lot of work, tests, and all the results are with me now. Unfortunately, like what you say, unfortunately, I don't have a good news for now. Okay, you just pause for a while, and then you can continue to tell that um or you can mention that the result is not as we hope, and then you just pause for a while. Okay, and then this pause need to last for a few seconds. Okay, and then after that you can mention that I'm very sorry to tell you that you have this condition called leukemia. Then pause again. Have you heard about it before? You can see that the way when I try to break the bad news is that you need to slow down your words as well. You need to slow down your intonation as well when you do that, very, very gently, and take your time. So this is how you break break the bad news properly. So if you really want to break the bad news, you should do it properly lah, huh? You cannot just say that, unfortunately, I got one bad news to tell you. It's too direct. Those those UK examiner, they very dislike this kind of direct breaking of bad news lah. So you should tell that, okay, unfortunately the result is not as we hope, and then pause, and then only then you tell slowly. You can do it something like that. Okay. But in this scenario, you shouldn't break the bad news because the diagnosis is not confirmed. And generally you have no idea what is the cause. It's just based on suspicion. There's no diagnosis at the moment. So you shouldn't break the bad news. If you ask me how I'm going to approach, later I will show you in the next slide how I'm going to talk about it. Okay. Second thing is that the second thing I need to really again stress and also highlight based on your presentation is again same as the first scenario. You use too much of jargon, like really a lot of jargon. You know how many jargon you use already?
Oh, banyak.
Banyak.
Mm.
What jargon that you use, if you can recall?
I think bone marrow, genetic, all that.
Bone marrow may not be a jargon. After you define it, it's fine. Okay, genetic is also not a jargon, but cytogenetic, molecular, and what again? I think got three or more jargon that actually you accidentally use it because it's something that we commonly mention easily, but we shouldn't mention all that technical thing and also the jargon to the patient. Shouldn't be that way. Okay. So unfortunately, this I would say you can do better actually. But unfortunately, look at the scenario. So in exam for communications station, you only got 10 minutes. You really need to budget your time, and you really need to tell yourself what is the task. You must follow the task. If the task does not mention that you need to explain the diagnosis, you don't mention about diagnosis. You just explain about the procedure and address the concern. So you focus on your procedure, pre-procedure, during the procedure, and the post-procedure, and you address all her concern. That's all you need to do. Okay, you don't do. I know that it's a bit fishy. You can see that suspected leukemia, so that's why you may want to review a bit like 50-50, or you want to like what you did is like straight away tell it's leukemia, without confirmation, but we still think this is leukemia. We just need to confirm it, but it's quite risky when you do that. Okay, so if you're going to mark you, just to go through, unfortunately, this is definitely unsatisfactory for the communication because you really use too much of jargon. Okay, and concern, I think you address most of it, and you also try to listen. I think it's fine. Clinical judgment part, I would somehow give borderline because I would say that you didn't really address the patient concern at first go initially. When the patient tell you that what is the alternative when you don't want when she don't want the marrow biopsy to be done, right? So you tai chi here and there, but you didn't answer that question. Only then I ask again. Only then you mention yes, you can take a blood from your peripheral vein again, but you mentioned about cytogenetic, which is a jargon. So so I would say that in terms of judgment, you cannot do that. Okay, you whenever a patient or a surrogate have a question, you must address it immediately. Some people like to do it like I will address you later on. The later on meaning you don't have time to address later on also. So you should address the question immediately. Q&A meaning you must give an answer. If the answer you don't know, you just say that unfortunately I have no definite answer for you. However, I can confirm back with my superior or my consultant. Okay. So welfare, I think you're okay. Most of the people will get welfare very well lah, unless you say something rude or anything. Actually, but for this, if you break the bad news like that, sometimes they will potong your welfare to borderline as well. So have to be careful. Okay. So how do you discuss? This is not an easy scenario, I would say. The idea is quite simple. This is just a team of explain a procedure. Okay, not explaining about disease. Okay, so you just need to explain diagnosis in brief first. So but because the scenario given you, we have to make use of whatever clue that we have in this in exam. So the result already tell you about this, and the patient, when you ask patient understanding, she can tell you that all the three lines is low, right? So you just use back whatever thing that mentioned to make it an indication. So you can mention it initially, like for example, you say that okay, before we after hearing, yeah, you're right in saying your condition, you have all the cells are low. However, just bear with me. I just want to tell you a brief overview of what is bone marrow. Do you know what's this? Not only because before you explain about procedure, right? The procedure is called bone marrow aspirate and purifying, right? So the idea is you need to explain the bone marrow first, right? Before mentioning about the biopsy and aspirate. So that's why it's important for you to straight away go to the part to explain that bone marrow is actually a group of spongy tissue inside the large bone that produce different blood cell. Okay, not all the cell in the body, but only different types of blood cell, including the red cell, white cell, and platelet. For your condition, as you mentioned, all your cells are found to be low. Okay, so for this reason, we have to do a procedure called bone marrow aspiration and purifying procedure. Have you heard about it before? Like what you do is correct, and then you try to understand whether she know about this procedure prior. So you have to define it also in a simpler manner. It's a procedure to remove a small sample, okay, of this bone marrow, and it's actually a common procedure like what you mentioned, can be done in the daycare setting, outpatient setting, or can be done when you are in the hospital. Is to diagnose various form of blood disorders, including cancer, by looking closely at the marrow and also the cell. So you should also, if the patient didn't ask you, if I don't want to do, what is the next step, things like that. So you can mention about that. Why is it important? Because if it's not performed, unfortunately, we may not able to confirm a diagnosis, and therefore we won't know what kind of treatment that we can give you, as well as we don't know what is the outcome. So you try to highlight the fact that why is it important to do. At the same time, also telling the surrogate that if not performed, what is the issues that you all will face. Okay, and then who will do? Just mention that you will perform by expert doctor. You want to mention supervisor consultant is fine, no problem with that. But because you only got 10 minutes, you need to make the sentence and the word that you choose simple and concise. Okay. So pre-procedure, you have mentioned about the palate, everything. Actually, not that important. You just mentioned that some of the blood tests will be done or repeated before the procedure to make sure you are fit for it. Just mention like that. Okay. Unless the surrogate asks you further, or how about if parallel anything to be done, that only you mention about that. But usually the surrogate will not be given such a specific question to ask. Okay. So, but you need to mention about you need to lie down on the bed with your sides on your side with the legs and knee all tucked up into your chest lah. Just to, I mean, if you don't want to mention, just lie on the bed on your side is also fine. And then usually it's generally the hip bone will be clean, and then the local painkillers will be given until the surface of the bone. It's actually not into the bone marrow, it's actually at the periosteum layer only. Okay, so until the surface of the bone to prevent any pain. However, like what you mentioned, also correct. You may not feel painful. However, sometimes you may feel the pressure-like sensation. And then following after, a small skin incision will be made, and then the sampling will be done in two stages, like what you mentioned. First is to draw some blood, and then put in the tube or stain on the slides, and for the lab doctor to look under the microscope. Second stage is to take a small sample of the bone tissue, okay, using a hollow needle. Then usually what they do is they will slice it, and then they will observe it under the microscope as well. However, another thing you should mention that this procedure might need to be repeated a few attempts as well, because sometimes you know that you won't be so perfect, right? Sometimes you cannot aspirate and it was dry tap, you have to repeat again. So sometimes a few attempts might be required to obtain a good sample. And then after the procedure, you'll be asked to lie down flat for a few hours to make sure there's no bleeding or any issue, and then you'll be monitored. And then, but again, highlight that for your condition, we understand that it can be a very uh, discomfort or scary procedure. However, I would like to stress that the benefit of doing this is actually more important than any complication that can happen. Okay, so the complication you mentioned about infection, bleeding, injury to surrounding tissue, you should mention. Okay, but I understand that you mentioned pain and bleeding and infection. Another thing is that, I mean, if you are talking about elderly patient, then perhaps you need to mention about fracture lah. But young patient is optional. I don't have to mention, it's fine. But again, any form of procedure, whatever biopsy that you're going to do, renal biopsy, liver biopsy, like BMAT, or any form of biopsy, you should mention that the risk of failure, that you may need to repeat the procedure if the result is inconclusive or the tissue is not sufficient. So you must mention about the risk of failure and need to repeat. So this is again one of the common complications that a lot of us will forget to mention if you are not very familiar with explaining a procedure. Okay, and then you also need to give the patient in terms of precaution. You have to inform us immediately or inform the nurse immediately if you have any pain or bleeding, or even if you develop any fever. So the only thing you forgot to mention is the consent. Okay, like what I mentioned earlier, any explaining procedure, explaining initiation of medication, you should mention about consent. Okay, you should mention that you can take some time to think about it, to discuss with your family members. You can also come back to us if you have any question. If you're agreeable, we will get you the documents for you to sign. Okay, and you are also have a right to withdraw anytime before the procedure if you have any change in your mind. Will that be okay? You must ask a question that shows that you are trying to take a consent. Okay, and perhaps it's a preliminary consent, but it doesn't matter. The idea is to try to take a consent. Okay, and then you ask about social history. I think it's okay, and then the consent summary is not very important, but like what you did, you got time, then you want to mention about leaflet, brochure, and website about this procedure, and you can update back the result once it's done. Things like that. Okay.
Okay.
Yeah. You have any question?
No,
So the lesson for your scenario is that you must really look carefully at what the question try to ask you to do. You don't do anything more than that, because it can be very dangerous. Okay. And some of the situation, sometimes the scenario that they give is 50-50 like that. They don't really tell you whether you want to tell or not. But if the task is not mentioned, you don't do. Okay, you don't tell anything about the AML. You may have leukemia, but what you can suggest is that under the indication to diagnose various form of blood disorder, and that also include cancer. Okay, so for that you already kind of like cover what is your goal, right? It's mainly to also possibility of cancer, but you don't immediately make it like a main dish and break the bad news as such. Okay, all right.
yeah.
Yeah. Any other question? Okay. Yeah.
Okay.
Okay. All right. Yeah. Thank you for taking
Yeah.
part. I can see that you are very hardworking. Today is like third day of Raya, Semi Raya. Okay.
Very good.
All right. So are you have do you able to get any seat for the upcoming diet?
I'm not registering yet, but planning to register in June, I think.
June. Okay, all right. I mean for the diet 3, I suppose.
Yeah.
So yeah, so try to practice. I mean tonight's session is probably for you. If you are going, if you are at the initial stage of preparation, is to know the general overview of the exam and what are the things that you need to be aware. I think if this is your first attempt for communication, it's actually not too bad. Okay, you know what to mention. You also got background knowledge. You just need to fine tune in terms of your approach, and that would be great. Okay,
Okay. Okay,
okay,
sir.
all the best.
Okay, thank you.
So yeah, thank you. So next candidate will be Zian. Zian, are you there?
Yes, can I, is it clear, my voice?
Yeah, I think you need to speak a bit louder. I think
Oh, okay, all right. Is it?
yeah, good,
Oh,
good.
okay,
Yes, good. Okay, so I will give you 4 minutes to prepare your scenario. Okay.
all right.
Okay, so your 4 minutes will start now. Okay, 4 minutes is up. Zian,
All right,
this is Mr. Sebastian. You can start now.
Okay. Oh, hi. Okay. Hi, Mr. Sebastian. So, I'm Lim. I'm doctors from the infectious disease ward. I'm here today to discuss regarding the conditions of your health conditions. Are you okay with that?
Yeah, yeah, sure, sure, doctor.
Okay. So, before this, may I just check your understandings uh, of you regarding your current condition?
Yeah, doctor. So what happened is that I remember I have a very bad headache and also blurring of vision. And then I was very ill. I came to emergency and immediately I don't know what happened next. Subsequently, intermittently, I was informed by the ICU team that I have done some surgery in my brain because there's a very high pressure to relieve it. And then now that the tube is out for me, I can breathe on my own. I feel a lot better now, doctor.
Oh, yes. Yeah, you're correct. So I'm glad that you actually have a quite good recovery and have attained a better state of health. So but I wish to tell you further regarding what we have found during this admissions.
Okay.
So during these admissions, actually during when you were in the ICU, we have took a quite extensive of the blood investigation to figure out what actually happens. So with all the informations on my hand, um, I'm sorry that we may have some unpleasant news to let you know.
Oh, what happened,
Okay.
doctor?
All right. So, from the blood test, we noted that the HIV test is come out to be positive.
Positive? Doctor,
Um,
can this result
yes.
belong to wrong patient, doctor?
Um, t- okay. I understand that, Mr. Sebastian, you come to very shock, big shock to you. However, HIV test we usually will confirm with a second test, which means that you always to make sure that the test result is 100% valid before we will let the patients know. Yeah.
Okay. That means
Mm.
you are sure that this result belongs to me.
Yes, Mr. Sebastian. Yeah.
Okay. Then
Mm.
but my question is that how can you all perform this test against my consent? I wasn't conscious that time. How come this test was being done?
Yeah. Yeah. I understand your concern. But first, I would like to stress that this investigation, the results is actually between the doctors and you. We will keep it very confidentiality. The first thing. And the second is, I understand your concern of why we didn't get the consent before we do the test. Okay. At that moment of time, you were unconscious, and we cannot get a consent, and we must do everything we can to make sure that uh, to ensure the best is given to you. So in that sense, we have act for the best interest of you, the patient, and we decided to send the test because the result is needed for to guide us to choose what kind of treatment that we can provide to you. Yeah.
Oh, but
So
it's very
mm,
very very shocking to me, doctor. It's very shocking to me. What is the next step for me, doctor?
so maybe I would just briefly uh um may I do how much do you understand regarding the HIV itself?
Yeah, I understand that it's an incurable disease, doctor. I understand that it was caused by some virus and it can invade into every parts of my body and it's generally there's no cure to it, doctor. It's very depressing.
Okay, maybe I'll give you some a summary just to let you know what is actually HIV. But the first thing I would like to let you know is that actually we might not cure HIV, but we can treat HIV. Okay, so HIV is a kind of virus that actually it affects our um, body immune systems, and it makes our body become weaker. So the symptoms that the patients may experience is that they may suddenly come with to hospital with some serious illness, okay, which is quite uncommon, and because their immune systems are already weakened. So of course, there are also patients that they know of their status because of they did some screening. Okay, so and this virus, when they weaken the immune system, it can make you easily prone to other infections, and these infections may be dangerous and causing a life-threatening condition. Okay. However, with the current technology advancement, actually we have come a lot far in the treatment, in which we have a special treatment in this kind of conditions to make this virus activities become dormant, and the patients can actually live a quite normal life. And is currently is more and more HIV patients is actually living have a normal lifespan and die because of other causes other than HIV.
Oh no,
Okay.
doctor.
Mm.
Does it mean that I need to take the medication lifelong?
Yeah. I understand your concern. Um, but in order to for us to suppress the virus activities, it is advisable to take the medication continuously so we can keep the virus under control, and then you may have live as normal life as possible.
Okay, doctor.
So all right. So are you okay so far? Do you have any things that come into mind that you may need that I may help to answer?
Yeah, I'm very concerned because you have found I got HIV positive now. Can you don't tell any of this result, especially to my partner?
Okay, so before I answer this question, um, okay, so all right, I do understand that you may keep it, you need to keep it as a confidential, but in this scenario, it's better that maybe you can try to let your partner know, as HIV is treatable, and we also wish for the best interest of your partner too, and also it is also for it's a duty for us to make sure that we take care of his interests also. So are you able to do that?
No, but why
Hmm.
am if I don't tell her what will happen? 2 minutes left.
Okay, so um, it's still preferable that you may let her know, because it's very important for her health. If you don't, I'm very sorry, but I think might have the moral duty, or there's as a doctor, to let her know about this, so that she may get her blood checked and then to treat if she's infected too.
That means that if I refuse to reveal this information to her, you will disclose this information to her instead of me?
Um, of course, it's in the best conditions. I will hope that you may help to let her know regarding this, as it would be more easier scenario to deal with. But if you couldn't do it, I'm very sorry that to make it fair to her, I may need to do so.
Oh, okay. But what
Okay.
is the you have told me you if I tell her then if she got this same virus, at least she can go for medication, right?
Mm.
Is that the reason, is that the only reason why I need to tell her?
All right. Based on current Malaysia's the our law and regulations is also, I may also need to report this case to our health ministry. So, but anyway, if you're feeling difficulties, and you maybe it's difficult to explain the things to her, maybe we can arrange another session, which we will meet both of you, so that we may discuss the diagnosis, and then the further treatment and the management, so that
Okay.
we
Time's
can
up.
answer all the questions.
Okay. All right. Okay, doctor. Thank you. Okay. Hi. Okay. Dr. Lim,
Uh,
have you encountered any HIV patient before in your practice?
Actually, honestly, not many lah, not many. Yeah.
What do you
Mm.
know about circle of confidentiality in HIV patient?
I do know there's the patients can decide the circles of confidentiality in which we need to explore who actually knows the HIV status for the patient. Is
So
it?
patient is the only one that can tell the result. I mean the status to whom he or she want to tell lah. So this is number one.
Mm.
And second thing is HIV is a notifiable disease or not? Because you mentioned about health
Mm.
ministry, right?
Yeah. Yeah,
It's
correct.
not. It's not a
Yeah.
notifiable
Okay.
disease. It's
Mm.
not a notifiable disease. Okay. So at least in Malaysia, okay, it's not a notifiable disease.
Mm.
So second point is that patient has the absolute right to tell who he want to tell regarding his status. Okay. So
Okay.
if he refuse to tell, can you force the patient to tell, or can you go against his wish and tell the partner?
But from what I read from the places book, I thought this is like debated area in which you want to care for the patients, or like the moral duty for the partners lah.
No, no, no,
So
no, 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 no.
no. Yeah.
The 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 the
Mm.
the justice or other ethical principle does not apply in this scenario. There's only
Mm.
two conditions that
Mm.
you should review the patient status to the next of kin. Only two conditions. There's only two conditions. And definitely not in this kind of condition that patient refuse to tell, but you insist that it's safe to tell and you tell against the patient wish lah. Cannot. Okay.
Mm.
First condition is if patient is in a very critically ill stage, that reviewing the HIV status will change the outcome of management, and therefore they need to inform the family members. And that is the may only. So let's say
Mm.
the management will not be changed, will not be affected, you still cannot tell. There's no role to tell even if patient is critically ill. Okay. Second thing is that you can only tell the partner regarding his status, provided you are the partner doctor in charge. Meaning to say you are the doctor that in charge of the wife or the girlfriend,
Mm.
and only then you can reveal the result or the status to her. Or otherwise, you cannot. Even if different doctor also cannot. Okay.
Mm.
Meaning to say that you cannot tell your colleague who is seeing for example, his girlfriend, and tell him that, okay, he actually have HIV. I think you need to let the girlfriend know or something like that. Then you tell another doctor, tell the girlfriend, it is also wrong. Okay, cannot do that. So
Mm.
strictly speaking, circle of confidentiality is very strict. Okay, it's very strict. Only patient can decide who to tell. Okay, so we must respect this. Okay, it's very important to know. And how to convince him to tell other than telling him that if let's say if let's say the partner is positive, at least he can get treated. This is number one, right?
Mm.
At least the partner can get treated. Okay, that's fine. Any other reason to convince the patient about this? Why is important to tell? There's actually three reasons why we encourage all the HIV patient to tell about his own status to the next of kin. There's three reasons of it. First reason you mentioned about, yes, so that the partner or the next of kin, if it's get detected to be positive, can get treatment. Okay, this is number one.
Mm.
Do you know any other reason?
Reinfection.
Reinfection? No lah, they all
No,
get the same virus strain, right?
I don't know. Yeah.
Yeah, it's not a TB lah. You continuously being exposed. No, actually, the second reason is important. You should tell the patient that actually it's important. We encourage all our patient to tell, is because when you are unwell, you really need someone to take care of you, and it's important that people who really love you, knows about your condition, and therefore they will try their best to take care of you. it's important for them to know about this other than until later on. Okay, so this is number two. So that if he's unwell, someone can take care. Number two reason. Number three reason is being if let's say he doesn't want to tell, his immune system is low, okay, he can acquire any infection from his partner easily if his partner is unwell, okay, because his partner, we don't know the status lah. Let's say the status is like normal people may be well for any common flu, but not for him himself, for the patient. So it's important that because your immune system is low, it's also important to really inform your next of kin or your partner that you got this condition, so that you won't get any serious infection for your partner. And then it's also important to let your partner know, so that if let's say your partner immune system is also reduced or weakened, it's important to get treatment. Okay, so you must highlight on these three reasons, so that the patient will try to understand and then say that, okay, it's okay for me to tell. Okay, so initially your discussion was okay. The initial part I'm also quite happy until the last part of the HIV. I want to peng san already. Yeah. So you have to be careful. HIV is a very sensitive kind of case that you really cannot afford to make a mistake. Okay, because that will really affect your judgment. Okay. So
okay.
another thing about this is, how do you feel about this scenario? Do you feel panic when you look at the stem?
I think I was panicked when I start the first sentence already.
Yeah, it's very long scenario, right? But this is like what I mentioned again, back to the first scenario. Sometimes the exam scenario can be very long and lengthy. So you need to take your time to read through and to dissect the important keywords of it. And then you need to really stay calm, take a deep breath, and then you focus and try to write certain things that's important. So what is your task here? So what is the team that is involved in this scenario? Like what we discussed out of the 11 one.
Breaking bad news.
Is it just breaking bad news?
Uh,
Before the breaking bad news, you
mm,
should it's a team of explaining a disease, right? Yeah. I
yeah.
mean, explaining a disease, whether or not you want to break the bad news. And for HIV, definitely is a disease that is not curable but controllable. And therefore, it's important to break the bad news. Okay. We all
Mm,
agree that HIV need to break the bad news. But the way you break, I think is fine. You give a warning shot, and then you follow by a pause. And then you tell immediately that he have this positive result. But you need to pause a bit longer, but after you tell him he have positive result, okay? You don't
mm,
immediately tell that, okay, but don't be worried, we are all here with you. So just let the patient digest a while, okay? So
okay.
if I'm going to do this scenario, I'm going to do something like in the next slide that I'm going to show. But before that, I just want to show your perhaps the marking. In terms of com skill, I think you can see that if you give inaccurate or unclear information, it definitely go into unsatisfactory. Okay, so for HRA part, unfortunately, you will get unsatisfactory. Concern, I think you're okay. You listen attentively. You try to acknowledge. It's fine. Judgment also, because of the understanding of on the HIV part, and also you try to notify to the health ministry, things like that. Unfortunately, you cannot get the marks. Okay, welfare, I think you are still fine. So basically, you are like 50% fail. But generally, if your com skill is that only get half of the mark, is basically mean fail already. Okay. Sometimes you can even fail everything if the examiner don't like the way you talk to the patient. You straight away everything unsatisfactory except the welfare. So mainly you only get maybe and the welfare, maybe you won't get full mark also. You will get like 1 mark each for examiner. So you'll get total 2 marks out of like 16. Okay, it can happen if you did a very serious mistake. So that's why it's important for us to know how to approach. Okay, so if I'm going to approach, I will do something like that. Okay, so this is a scenario that when we explain disease, we also sometimes we always want to try to invite anyone want to be around, things like that. But this is a one type of scenario that we don't want to invite anyone. It's very strictly confidential. Another type of scenario that you don't want to invite anyone is the one that involves suicidal, okay, like overdose, things like that. Okay, so yeah, someone asked about the question: isn't HIV is a notifiable disease in Malaysia? Okay, so I know that if you look at the borang that we have, HIV is a notifiable disease, right? But it's actually not. Okay, TB is a notifiable disease, infectious disease is notifiable disease. But actually, even if according to the UK latest law, I mean in terms of the UK British law, HIV is no longer a notifiable disease. Okay, this is very important. Okay, we generally follow the UK lah. And if you encounter any HIV patient, right, we generally don't notify a HIV positive patient. Okay, we really don't do that. We don't fill out the form and we don't do the result positive like that. Okay, so okay, back to the scenario. So you can see that there's a lot of ways to open the conversation. You can mention something like, for example, I can feel that you have gone through a lot during this hospitalization. What do you understand about your condition? Things like that. But again, I mean, he understand that he got some infection in his brain. If you want to make an opening sentence before you tell it's a HIV result, it's also fine. You can mention like about the cryptococcal meningitis first, but you do it in a layman's term, in which you say that it's a form of yeast infection towards the protective lining of the brain. Okay, it usually occur in a patient that has a very low immune system, and the headache, breathlessness, things that symptom they experience is what explain the disease. And the management, we have started some medication. Which requires a long period of time to kill off the yeast. Okay, only then you bring over the topic of uh, uh, this HIV result. So you break the bad news. You want to break the bad news first, or you want to tell the result first, or you want to mention about indication is also fine. Because the indication, if you don't mention also, like what the patient going to tell you, if the patient is asking you that how can you take the I mean you order the test against my consent. Okay, so it's important for them to understand that because his condition is very critical, and we have done a lot of tests, and part of the test that what you mentioned is to identify that any reason that cause your immune system to be weak, because we need to really treat the underlying cause. You mentioned like that, and if let's say it's not being recognized, then unfortunately will lead to delay and also complication. And this include the HIV test. So only then you can break the bad news before or after also, like depending on the flow. And then after you tell the result is positive, you should tell that how do you feel about this? I can feel it's really overwhelming for you. And then just give some time for the patient to express the emotion. And then another thing important for you is that although it's not compulsory, but I would prefer to try to elicit how he get the HIV result. Okay, it's important because we need to know, try to elicit the social part of it and how the patient get HIV. So perhaps the next question you can ask is like, have you ever thought about your previous lifestyle and possible risk of exposure to this virus? Then you can, the patient may tell you a bit on their social issue, and that also save your effort to ask about the social history. Like you don't have to ask a lot of things. Okay, and the next thing is try to explain the HIV. Yes, you mentioned that HIV is a virus that weaken immune system. Symptom can be very mild and subtle. Complication can be serious. Infection management, treatable and curable is the same thing lah. So when you mention about a disease, you are actually talking about whether it's a supportive, whether it's a controllable, or whether it's a treatable or so-called curable. Okay, so HIV is not curable or treatable, but it's controllable. Okay, with a combination medication, it can suppress the virus to zero, and with zero also means zero risk of transmission, and you can live same like normal person. Okay, zero equals to zero. Okay, so the outlook can be good with medication, and then however, although it need to be taken lifelong, it can suppress the virus and you can live as normal as others. Okay, and then you also need to stress on the precaution part, because he is very immunocompromised at the moment, he's still infective. So you need to tell him that it's also important for you at this point of time that you should, if you want to practice any intimate relationship, you can, but you need to practice the safe precaution, and you should avoid any form of sharps or any needles sharing. Let's say you have, and then you should avoid any blood transfusion. Okay, you should mention all that as well as part of the precaution, and then you should also ask about concern. So the concern in this is perhaps is the one that advise the patient to inform the partner lah. No? We wish you already done that, and then from our point of view, we shouldn't inform, but we encourage. Actually, the initial approach that you do is correct. You tell the patient that actually we encourage you to inform, but subsequently when I challenge you further, if let's say he disagree, then you started to show some force to tell him that we will still inform. So that is wrong. We cannot do that. We cannot do that. Okay. And then last, you can mention about booklet, leaflet, pamphlet or website to explain about this condition and address any further question. Okay, I think it's someone raised hand just now, right? Liu, or is it like mispress? Maybe it's a mispress, is it? Liu? Okay, maybe it's mispress. Okay, so yeah, Dr. Lim, you got any question regarding this scenario?
Yeah, no.
You're clear. The
Yeah,
most
yeah,
important
clear.
thing is, I mean, HIV scenarios can be quite common. It can be like this, a scenario, or regardless what scenario that they create lah. So it's just to break the bad news, explain about HIV. Okay, so the scenario will be a bit tricky. Like for example, needle stick injury, and then the patient is HIV positive. Okay, this is another possible scenario. This scenario is something similar like those that, for example, has done a scope OGDS, found some esophageal candidiasis, and then counsel for HIV testing, something like that. Okay, there's also some other scenario. For example, partner is positive, and then the patient came, I mean, the surrogate came worried, want to request for the test, and then to address the concern, things like that. So there's a lot of variety of HIV related scenario that can happen. So the idea is we need to know how to approach it. Okay. Yeah. So Liu is raising the hand. Yeah. You got any question? Hello? No question? If no, we'll proceed then. Okay. If anyone have any question, if let's say it's audio issue, then perhaps we should can text can type in the chat box lah. If the patient asks to repeat HIV test, how should we go about it? So generally when the scenario mentioned that it's positive result for HIV means it's positive lah, huh? So when the patient challenge you that can this be a false result or false positive result, things like that, you have to be firm saying that, because we will have to follow the scenario. We have to say that unfortunately this result has been verified and confirmed. Okay, it is really positive. Okay, so there's no question to it unless the scenario make it like taken during at what time or things like that, or may not be uh give a give a window or space of creativity saying that there is a possibility that the result may not be true, then yes. But for scenario like they mentioned the positive result for HIV with a full stop and no other hint or anything given, so we have to take into assumption that this is the result for the patient. Okay, because otherwise the scenario will have written other extra point for us to digest. Another question is that if patient asks about insurance company, do we have to disclose about the HIV status? So again, HIV we should not disclose to any party. Okay, that also include insurance company. Okay, so this is a very strictly confidential diagnosis. So we don't disclose this diagnosis to an insurance company. What we usually do is that we encourage the patient to inform. Okay, it's the same approach like what for this scenario approach. Encourage the patient to inform for example, the partner or even the insurance company, because the reason is being if the insurance company knows about it from the later on, not from the patient, then the all the insurance might be void. But not necessarily that if patient is HIV positive means they are not covered. It not necessarily means it's not covered. It just means that they need to inform, and then they need to a formal medical board or director to assess the patient, and then whether or not it's still eligible or not. But those things are out of our jurisdiction, so we shouldn't mention that whether or not we should inform the insurance company. We shouldn't do that. Just encourage the patient to do. Okay, so okay, for that I think we go to the fourth scenario. Fourth scenario should be Cartigan, right? Cartigan, can you unmute yourself?
Yeah, Katiban.
Okay, so you are ready for the fourth scenario?
Yeah.
Okay, so your time start now. Okay, time's up. Dr. Katiban, are you ready?
Yes. Okay.
Okay, so this is a patient. This is the patient's son, Mr. Thompson. Please start.
Okay. Hello there. I am Dr. Katiban, one of the doctors in the renal ward. Can I confirm your name and age?
Yeah, I'm Mr. Thompson here. I'm 30 years old.
So, Mr. Thompson, can I confirm that you are Mr. Jerry's son and you are the next of kin?
Yes, yes.
Okay. So, Mr. Thompson, sorry, we are here today to discuss regarding your father's condition.
Mhm.
So, before I go further, can you let me know how much do you understand about his condition so that we can start off on the same page?
Yeah, doctor. I understand that my father have a very bad kidneys. Doctor told us that it's actually stage 5 and may require dialysis soon. He have done his fistula over the right hand, over the right forearm, sorry, 2 weeks ago. And then now he came in because of breathlessness. And I was told that he need to underwent urgent dialysis. So he was dialyzed a few times in the ward, and then he's planned for discharge. And then the doctor told us that they need to switch the catheter, the tubes for dialysis from the leg, change to the one over his chest. So, the doctor just now I received a call for us to come immediately because there is something happened during the procedure.
Okay, as you have correctly understood, Mr. Thompson, yes, your father basically has underwent temporary dialysis and then also required a alternative form of dialysis using the neck. However, unfortunately, there has been a complication that has resulted post insertion of the tubes in the neck. Are you aware of this?
Yeah. No. I mean, complication as in what?
Yeah, okay. Unfortunately, this procedure usually has some amount of complications that can happen, and in your father's case, unfortunately, has happened to him, whereby the tube has slightly moved in a abnormal position, okay, into the chest or into his chest, resulting in small injury to the lung, resulting in collection of air in the layers covering the lungs. Okay, which is
Okay.
yeah. So have you heard about this?
No. This is the first time I'm hearing.
Okay. Yes, I totally understand, and this must have come as a shock to you. Okay, but we have taken the corrective measures immediately for him upon knowing that this has happened. Okay, started him on oxygen supplementation, and he was initially quite stable. Okay, unfortunately, as under close monitoring, even though we closely monitor him, he has slightly become confused. Okay, at the moment, and on further review of his chest X-ray, we have noted that the collection of air has worsened or increased. Okay, so are you able to follow this far?
Yeah, doctor. I want to ask, is this a form of malpractice?
Okay. No, Mr. Thompson. This is one of the complications that must have been already explained to you prior to the procedure. Okay. These complications can happen to anyone, although done by experts. Okay. And unfortunately, it has happened to your father. But at this point, we have to look forward on what needs to be done to ensure that he gets he's able to recover and comes out safe of the complication that has resulted. Okay.
Okay. So you are saying that you need to do putting in a tube into his cavity of the lung to remove the air, right? What
Yes.
what can you tell me about can you tell me further about this procedure? I want to understand
Yes.
more.
Yes. As you have rightly understood, yes, we are going to he will require a procedure, okay, whereby a tube will be inserted at his side of his chest, into the space of the layers between his lung, covering his lung, to allow the air to escape. Because unfortunately, in his condition, the amount of air is significant and needs to be released immediately to ensure that the lung can expand. Okay, as you know, the lung is a balloon-like structure that requires that does a lot of exchange of air. So this collection of air in the space will definitely impede these processes from taking place and can result in can endanger him further and can even be fatal if delayed further. Okay,
Okay.
so it is an urgent and emergency procedure that needs to be done.
Okay. So what are the
Yeah.
potential complications that can happen?
Yeah. Okay. So this procedure will be done by our usually by a experienced operator or senior doctor. Okay. So he will be positioned and the area will be cleaned to ensure that to prevent infections from taking place. Okay. And then we will give him adequate pain relief medication to the area that we are going to make a small cut and opening so that we can insert the tube into the chest space. Okay. So throughout the whole procedure, it will generally take about 15 to 20 minutes, and it will be done under close monitoring and also supervision, and done by a senior and experienced person.
Yeah, yeah,
Okay.
but what is the complication that can happen,
Yeah.
doctor?
So the complications that we foresee that can happen to during this procedure is mainly bleeding, okay, due to cutting, making a small cut can happen bleeding, but it will be controlled and we will take the necessary measure to ensure bleeding is under control, okay, and then infection as well as injury to the surrounding structures because there are few nerves and other blood channels that also pass through close to the area that we are going to insert the tube. But it will be done according to the protocol, safety protocols, to minimize the this procedure or complications that can happen. Okay. So that is why we are here to. These are the main complications that we foresee that can happen, but we will take the necessary precautions to prevent it from happening.
Yeah,
Would
doctor.
that be
How
okay?
how long does he need to stay in hospital then? Because I was told that he can be discharged today after the procedure.
Okay, unfortunately, I totally understand your concern. That he was on the way home, but these things sometimes happen, and we have to take the corrective measures. So this procedure, and hopefully that if it works well for him, he will be observed for a short stay. And once the air collection in the space has been relieved, then he will likely be able to go home once we feel that he's stable and we can remove the tube. And post tube removal, we observe him, he's fine, then he should be able to go home. Provided we have sorted out also his dialysis related problems before he can go home.
Okay, all right.
Yeah.
So yeah, I mean, will he need this dialysis tube for lifelong?
Okay, unfortunately, yes. The status of his kidney has been deemed to be in the stage where he will require long-term dialysis. That is why he has done the fistula. But the tube in the neck would be a temporary one till his fistula is mature or ready to use.
Left.
Once the fistula is ready to use, then we can generally use that and the tube can be removed.
Okay, okay.
Okay. So another concern is okay, your father at the moment is not in the ability to make a decision for himself. So since you are the next of kin,
Mhm.
have you understood my explanation? Do you have any other concern regarding my explanation?
Yeah, yeah. I think it's really important to put in the tube to remove the air from the lung cavity now. Yeah, yeah. I understand. I think I will sign the consent for on behalf of him.
Okay, okay. Since you are next of kin, so I will prepare the necessary documentations for you to sign so that we can make the arrangements and also proceed as soon as possible. As I told you, this is a urgent emergency procedure that needs to be done.
Hmm. Okay.
Okay. So, do you have any other concerns that you would want to know?
No, no.
Okay. So, so if that is so, then I will go ahead and make all the arrangements. I'll bring the necessary papers for you to sign. If at all you have any questions at any point in time, you can always consult me, and I will be there to help you at any moment that you require. That be okay?
Okay, doctor. Okay, thank you.
Okay, thank you.
Okay, yeah, thanks, Dr. Katiban. So, what is your feedback on your performance?
Looks like a few agendas for me to address. One would be the capacity of the patient and consent, and
No,
then procedure
as in,
explanation.
any issues in terms? I mean, what do you feel about performance? Do you have anything, you feel that you have done something not so appropriate, or for example, not so correct, and then anything that you can do it differently? Anything to comment in terms of your performance?
Maybe the structure of approach probably could be more organized, I think.
So I did ask you about complication for the chest tube, right?
Yeah.
But you diverge it and then becoming explaining the procedure again.
Oh, okay. I understand.
Yeah. So again, back to the question that if surrogate asks you one question, you answer the question immediately straight. So sometimes your flow doesn't need to be following your own approach lah. You have to modify a bit. If the surrogate asks you something that you haven't managed to talk about, you should have jump to there first and then you come back later. It's fine. You don't have to be very like A to Z. So it's also, I mean, but otherwise in general your performance is good. I would say it's very smooth and then it's very clear, and you try to get the feedback from the surrogate a few times to make sure that the surrogate understand, and that is really good. Okay, so
Okay, sure.
perhaps for this scenario you will get the full marks. I have no question, no added things to add, because you have counseled quite well. Okay, so perhaps just to recap a bit, and in terms of how do you explain about pneumothorax, perhaps you can mention about like leaking of air into the space. You can mention it, like, and then it can causes the lung to shrink like a balloon. For example, you want to mention it. If you don't want, it's fine. And then it's a life-threatening complication if it's not done. Then indication is like I mean all those things you have mentioned lah. And then the important thing, the important concern is to make sure that to clarify that actually this is not a medical error, this is not a malpractice, this is a complication that unfortunately happened. And however, please bear in mind that your father is in our best interest. We're going to provide him the necessary care, and then we'll try our best to do this. And for this reason, we will need to put in a tube to remove the air, okay, so that the lung can expand. So you can also mention that pre-procedure, procedure, and post-procedure. You mentioned about ultrasound. I cannot recall you mentioned about the guidance in terms of putting in the chest tube.
No, I said safety location. I didn't say ultrasound.
Oh, safety. Okay. Ideally we should lah. But I know everyone just joke like that. But ideally we should, because to really scan which level lah. And then performed by expert doctor. I think everyone mentioned about that. And then the skin will be clean, anesthesia, anything is okay. And then the drain, it's also important to mention about the underwater seal part lah. Perhaps you don't need to go into detail. Just mention about the drain with anchor and then the connect, and then we should show bubbling. The whole procedure is usually quite fast, and then he will monitor and assess, repeat the X-ray, and then the tube may need to put for a few days, and then once the lung is fully expanded, it may be removed later on, things like that. And then you also need to, again, back in our procedure as well, you should also mention regarding the complication that can happen other than pain, bleeding, and infection or injury to self-organ, is that the chest tube may actually fail, or I mean the procedure can fail and may need to repeat, or even if the procedure is successful, if let's say it fall out or fail to function, it may require reinsertion. It's the same idea like the case system. So we have to keep, I mean the rest of it is fine. You manage to ask about concern and also the consent, the important thing. Okay, and then you try to summarize. You can also mention that I will provide you some information guidance on the chest tube so that you understand, and also as well as this condition called pneumothorax. Okay, and then we'll come back to you for any question, things like that. I think you generally is quite smooth. I would say you have no question for this scenario. So if you want to grade this or even stage this scenario, like which team that this scenario will fall into under the 11 teams?
Procedure explanation as well.
It's more like explain complication from
Complicated
procedure or medication, right?
procedure.
Yeah. So it's fall under the complication part. Okay. So this is again, we need to be very clear that this is not medical error. Okay. We need to tell that it's not medical error. Okay. Any question from the floor or from you?
No, fine.
No question, right?
Okay.
Okay.
Yeah.
All right. Thank you so much. Okay.
Yep.
So
Thank
I just want to go back to the third scenario just now regarding the HIV, right? After I counter check with my ID teams, okay, in Malaysia, just to correct back, in Malaysia, yes, indeed, our law under the national notification as well as the form, yes, in Malaysia we need to notify the HIV positive patient. We need to notify that. Okay, that's for the disease notification, but notify the disease does not mean inform the employer or inform the insurance company or inform the partners lah. Now again, the disease notification is just notification. Okay, but if you based on the UK law, the disease notification under HIV is not mandatory. It's actually mentioned as statutory. The reason is being they just changed the policy somewhere between 2011 to 2014 lah. It's because the HIV positive patient, the outcome is as good as normal people with treatment. So it's no longer considered a disabling disease or it's a very infectious disease, although it carries a significant public health concern. Let's say the patient did not inform and then, for example, continue to spread under the sexually transmitted infection and all those things. But in UK, it's no longer considered as notifiable disease. Okay. But in Malaysia, yes, if the surrogate examiner want to test you whether you need to notify, then you have to mention about yes, unfortunately you will need to be notified. It's a notifiable disease in Malaysia. Okay, but it does not mean that we will inform or we will disclose your status to your next of kin, to your employer or even to your insurance company. Okay, just a major correction lah, because I also need to make sure that certain thing is a bit different from UK and Malaysia, because this is one of the difference that we encounter. Another difference is also in terms of the organ transplant. So organ transplant in UK started in the COVID era, 2000 somewhere between 2020. They just changed the transplant policy to be all is actually is a opt out policy, meaning to say all UK resident is considered automatically as a transplant, as an organ donor, unless proven otherwise, unless they pull out themselves, unless they pull their name out from from their registry, or unless they are not the UK people, or unless, for example, they are below age of 18, or unless they are not able to give their own consent, mentally challenged. Yeah, sorry, I need to mute something. Okay, but it's very different compared to Malaysia national organ donation and transplant policy, in which Malaysia is very different, in which we can only talk about organ donation and transplant if the next of kin agreeable to it. Meaning to say, if the patient pass away and patient is signed under the already signed the donation card, okay, already registered as a donor, okay, and if the patient pass away, but let's say the family members refuse for transplant, or refuse for the organ donation, then we cannot proceed, unfortunately. This is based on the Human Tissue Act in our Malaysian law. So we cannot do that until the family members give the agreement, say yes to this, okay? Because it's very different from compared to UK. If this same scenario happened in UK and Malaysia, the counseling is going to be different, because if it's in UK, if the family member refuse, unfortunately we have to tell the family member regarding the opt-out policy thing, and then to mention that actually all UK people is actually is automatically is an organ donor. Okay, unfortunately his name is not included, it's not excluded, and then unfortunately we will not able to respect your decision that you don't want to offer him to be a donor. And generally in UK point of view, if you look back at their policy, the reason why we inform family members or we involve family members is so that all the procedure as well as the rituals will go in the line of the patient belief as well as the family members wishes lah. But it does not change the fact that the organ donation will be carried on. Okay, but this is very different in Malaysia, in which Malaysia will need to get a consent from the family members or the next of kin before proceed. So this is why it matters lah. As well as same goes to this HIV scenario also. If you ask whether it's a notifiable disease in Malaysia, the answer is yes. But if it's a notifiable disease in UK, actually it's not. Okay, so there is different country got different policy. Okay, this is what I can conclude. So we will proceed with the last scenario. Anyone want to take out the last scenario? I will open to the floor first. If no one wants, then we will open to any of the 4 candidates that I've tried just now. So anyone on the floor wants to try? Perhaps no one got the Diet 2, right? I was told not many people get the Diet 2 seats. So no one. So how about those that try for the attempt just now? Anyone wants to do the last scenario so that everyone can benefit as well to learn together.
If no one, I can do.
Yeah, Katiban, you want to try the last scenario?
Can. Sure, can.
Yeah. Okay, sure. Okay, if no one else object, I think we'll let Katiban to try. So I will give you 4 minutes again. Same thing. Your time will start now. Okay, time's up. Dr. Kadiban, this is the daughter, Madam Ain. We can start now.
Okay, hello there. I'm Dr. Katiban, one of the doctors in the renal clinic today. Can I confirm your name and age?
Yeah, I'm Ain here, 32 years old.
So, Madam Ain, we are here today to discuss about your mother, Madam Fatima. Okay, it's
Okay.
keen. So,
Hello,
we are
your line
here
isn't
to
clear.
discuss. Okay, can you hear me now?
Yeah,
Hello.
sure. Now it's better.
Okay. Sorry. Yeah. So, Madam Ain, we are here today to discuss about your mother's condition. She has given us permission to speak to you regarding her condition. Okay.
Okay.
So, before I go on further, can I know of your understanding of what is going on with your mother so that we can start off on the same page?
Yeah, doctor. So my mother has a kidney problem for a very long time, and we are informed that his kidney is not functioning well, and is already reaching stage 5, which is the last stage, and he definitely needs some form of replacement therapy, including dialysis. So we are very concerned and we are very anxious because she seems reluctant to go through this, and we're very worried that we will lose her soon, doctor. He's very weak now at home. He cannot come. That's why I'm coming on behalf of her.
Okay, Madam Ain, I totally understand your concern. Uh, You're very correct that your mother's condition currently is in advanced stage of kidney failure. Okay, I'm sorry that I have to that what I'm going to talk to you may be difficult for you to take in altogether. We will take it slowly, and if you have any issues or any concerns along the way, you can stop me, and then we will discuss further. Would that be okay?
Okay.
Okay, so as you have correctly understood, she is in the last stage of a kidney disease requiring further support. Okay, but unfortunately, or rather to say, your mother has made a decision that she doesn't want to be on machine support for the rest of her life. Okay, are you aware of this?
She doesn't really tell us about that, doctor.
Okay, yes. It's my duty to let you know that she has expressed her concern that she does not want to be on any form of machine support because she feels of that it will affect her quality of life and also result in a lot of pain. Okay, so I know that as a child, we really want our parents to be with us for as long as they can. But unfortunately, somewhere or other, we will have to listen to them and also follow their wishes. Are you able
Okay,
to
but
follow?
but doctor, we all love her very much, and we cannot understand why doctor refuse to prolong her life because we really want to see her more. You see, the longer we can see her, the better we feel, and then at least we can see her longer. We don't want to lose her, doctor.
I totally understand your concern, Madam Ain. But however, firstly, you must understand treating a patient is mainly a patient centered approach. Okay, whereby patient's interest is our main concern. Okay, and your mother has been counseled a number of times throughout the previous sessions regarding the benefits and also the disadvantages of going through dialysis, and she in her capacity has made the decision that she doesn't want any form of support. Okay, although you may think that going through these procedures may prolong her life, but sometimes it may cause more suffering for her if that is not what she wants.
But
Okay.
doctor, can I sign on her behalf for dialysis? I
Okay.
think I think I think she's not in her right mind to make decision lah.
Okay. Madam Ain, this decision was made some time back. Okay. And has been in a written form, and also a living will has been already made by your mother. okay, for us to follow as a directive, okay, which is one that we will follow because it was made by her when she was able to evaluate all the information that was given to her. Okay, so it won't be right for us to override the decision that was made by her and to put her through what she doesn't want to go through. I think anyone, even us, would not like to be forced to do things that we don't want to. Okay, so I think it would be best for us to consider or put first what your mother wants, and then maybe you can rediscuss with her. But I think it's best for us to follow suit what has been decided by her when she was well.
Yeah,
Okay.
doctor, but we really feel guilty to let her go just like this. Is there any alternative to this?
Yes, I totally understand your concern. We can assure you we are not just going to let her go like that and go through suffering without supporting her. Okay, so what we have suggested is that we would like to refer her to a specialized team known as renal palliation or renal palliative team. They are expert team of doctors who are trained to manage this kind of condition whereby our main aim of treatment is not to treat the condition but actually to give comfort care to the patient so that they can enjoy a better quality of life with minimal pain or suffering that they have to go through. Okay, have you heard of this before?
No, no, doctor.
Okay, so this is a specialized form of treatment usually whereby the team of doctors, they will be seeing your mother separately. Okay, and also they have many approaches. One of it is, of course, focusing on your mother to ensure that she is having comfort and less pain or suffering. Okay. Otherwise, they can also make arrangements to have home visits to to facilitate a better home environment for your mother, so that, as you know, without dialysis, her days, she may have a certain fixed time on this earth. So they will help you to prepare her better so that she has a better and easier last few days as she go through.
Yeah, but doctor, is this palliative care also means like giving up on her care as well?
Okay, as I told you, the aim of treatment from the aim of approach in palliative would be more for comfort care. Okay, the treatment, as I told you, was as earlier, is mainly by dialysis. Okay, or renal replacement therapy. Okay, that was the main way of treating the patient. But
2 minutes left.
your mother's concern was that she preferred a palliative approach. So our mainstay of treatment would be to give comfort care, relieve her of all her pain and suffering, minimize, and also ensure that her home environment would give her the comfort that she needs as she goes through this.
Mm-hmm. Hello?
Still
Hello, can you hear me? Yeah.
able to follow?
Yeah, doctor. But
Are you
how
able to
long we are
follow?
talking to? I mean,
Yeah.
how long how
So
much time left we have with her then, if we are going towards this direction?
okay, so uh, we usually okay, we never give a certain fixed time, but to be honest, the time is quite short, a couple of months maybe. But along the way, we will be there to support your family as well as your mother to ensure that she gets the comfort care. Okay, but there is no fixed time. It will depend on how she responds to the treatment and how her condition or her disease progresses.
Okay, doctor.
Okay, so I know there is quite a lot what I've explained to you. Do you have any other concerns or any confusion that you would like to clarify with me?
Yeah. From what you have told me, if this is what she have agreed with the doctors, and this is what she really wanted, I think we will go into the line of supporting her, and I'm also agreeable for this palliative care referral. Yes.
Okay, Madam Ain, that is good to hear, and I can assure you, me and my team, we will support you. We will refer you as soon as
Hands up.
possible to the. Yeah. Okay. Thank you.
Okay, all right. Okay, so Dr. Kadiban, is there anything that you think that this scenario is a bit tricky or it's a bit different? It's a bit difficult in the sense of try to convince the daughter.
Hmm. I think she, but I'm not that sure, doctor. Actually,
So you see
where
what is your task actually based on the scenario
palliative care lah, or end of life care.
before the
Palliative.
palliative care?
Regarding disease explanation as well.
Yeah, the disease explanation part. So I need to highlight this is because although we know that CKD stage 5 is something very easily understandable for all of us, right? We know that this is like end stage renal failure. But bear in mind that we are explaining this to a layman and we need to define what is CKD stage 5. Okay? We really need to define it. So you must try to define it because I did something similar. I mean different cases, different scenario, but something similar that the examiner, one of the examiner query is actually candidate did not explain what is CKD stage 5 and assuming that the patient or the surrogate knows about it. So it can be quite dangerous because you are expected to understand to explain about what it mean by uh, end stage kidney disease. So you must mention that her condition is not good. Based on the result, it shows that she's already belongs to the 5th category, which is the last stage, in which slowly she will have almost no urine output, and slowly all the toxin may build up in her body, and she may feel itchy. She may also have fluid that build up in her lungs or in the body, and there's also some issue in terms of the salt level that can actually can be dangerous if it's extremely high. So all those things you need to explain first before you talk about palliation and also the rest lah, to address the concern. You must really do the task. Your task is to explain the condition. And then yes, I know the main part of this is to counsel regarding the advance directive and also the denial to address the denial of the daughter against the patient wish lah, correct? So that one I think you do well. But again, from because I'm a surrogate, because from my point of view, I feel like the way you talk to the surrogate is a bit I would say a bit forceful. You say that your mother has already signed this. You try to convince the surrogate by saying that she have done all this and she already say the reason why she refused. And as a human being, even if I'm being myself, I shouldn't I don't want anything that is against my wish. I feel like, I mean, in this sense, to use us to think in patient's shoes and then to mention like that is a bit inappropriate lah to me. I would actually for this approach, right, I won't go so harsh on it. I won't go so forceful on it because this is a query return advance directive lah. So our idea is not to convince the family members to accept what the patient want, but rather for them to understand. You see, so it will make a difference because if you try to convince, then you state like what you do lah, like what you did just now, and then state all the reason that she don't want this and that. Therefore, we should respect that. But if you think in another way that you actually want them to understand, and this is something that is already decided by the patient, and then you really want them to understand, so you should perhaps go a bit gentle. Way would be, for example, the daughter mentioned that she love her, she want to see her longer, things like that, right? So perhaps you can mention that I appreciate that you really love your mom. Okay, you can go for the softer way lah. You can say that, but love come in various form. Sometimes when we are doing something against her wish, we may not able to make her feel relief or even happy, even at the last stage of life lah. You just mentioned like that, and then you just mentioned that I hope that perhaps there's reason that maybe she didn't reveal this decision to the family members, but I would think that our role is to let you all understand that she really don't want to go through this, and then she have made this decision despite we have counseled her multiple times, and then only then you bring on the reasons slowly lah. I mean, in terms of the, I would say in terms of the point, not much of difference, but in terms of approach, there is a difference because when the examiner see you talking to the surrogate, right, the examiner can tell that you are forcing the surrogate to do a decision or you are trying to let them understand. There is a difference. Okay. So you
Yeah.
must, this kind of scenario, you must make it a bit more gentle and then you must make it a bit soft, I would say. But otherwise you address all the question well. I would say not much of major issue.
Sure.
Okay. Right. You have any question?
Understand. Thank you. Nice. That was
Yeah.
nice. The way of the difference. I understand. Thank you.
Yeah. So again, just want to discuss regarding this lah. So that's why it's important that you need to go back at the scenario and look at what the task is being assigned. If the task is being assigned for you to just introduce renal dilation, then perhaps your focus is just renal dilation and address the concern. Okay, but the task is to explain regarding condition and then only introduce. Then perhaps you need to talk a little bit about the kidney disease end stage. Okay, so that's the important thing lah. It's more of exam technique instead of I'm like sharing about how to score in exam. It's more to sharing about the tips and how to really tackle the exam well lah. And then you can see like what I mentioned kidney main function is to do what and what, and then the symptom will what, and then the lifespan generally will be limited without any form of therapy replacement. Generally the guideline says lah, this is also from the study, a patient that has end stage kidney disease, if without kidney replacement therapy will only live about 1 to 2 weeks, but sometimes can be longer. But definitely not months lah, definitely not months. If it's already declared to be end stage, then it's really, we are talking about weeks lah. And then explain about the decision. Yes, you have done that as well. Multiple counseling, and then reason for reversal you also explain. And then you also, but the main important thing to highlight in this scenario is to try to address the patient surrogate, the patient daughter emotion lah. And then try to make the daughter understand so that she can respect her decision, but not in a forceful way, and emphasize on caring as well. And then the goal, like what you mentioned, is the symptom and comfort care. Only then you bring in the idea of palliation. I think the way you define palliative care is very, I would say, very keyword based. I can see a few words keep on repeating, but perhaps you can make it a bit more a natural way to tell. It's a form of treatment that does not target the disease itself, but rather to keep the patient as comfortable as possible and managing, because you're only focusing on pain mainly, right? But there's also some other thing like distressing symptom, and this involve multiple teams, and also sometimes involve spiritual, psychological way as well. I'm very sorry to tell you, but this is important for those who love her deeply to understand. And then if you want to know further, because your idea is just to introduce only, you don't have to explain everything under the sun, right? And we definitely don't have time for that. So it's also important that for communication scenario, right, when you think it's a bit complicated, when you think there's a lot to take in, you can tai chi. Okay, basically you can just direct to the better person to speak more detail about it, arrange a further discussion or escalate to the consultant, things like that. You don't have to tell everything in detail. The idea is to introduce, so you just introduce, and then if interested, you can arrange a meeting and then to discuss further lah. And then another thing important, I would say if, because actually you have time to, at the end of the session, you can try to elicit the social aspect of it. You can try to understand that from the daughter point of view, do you have any issues to take care of her? Do you have any financial issue? Do you think anything that we can help you? We also have this home visiting based kind of service that can be arranged. Basically, it's non-government based services. Are you keen to pursue this? Is this something that you want? You are keen to do that, or this is something additional that I would say it will make the communication station complete lah, by including the social aspect. So it's important not just to talk about the main dish lah. After you finish everything, you got nothing to talk about. It's the best time when you go into social, because social is the one that the examiner will be focusing sometimes and most of the time, because somewhere in between they may be very sleepy and they may lose focus also. But the last part of the discussion, they will definitely be on all their ears because you need to give your marks already. So definitely the last part you need to make it very nice and proper. Social is something that will give you some bonus, and then the summary, I don't think summary is very important. If you don't have enough time, then you don't have to do that. But concern is definitely important. I think you have addressed the concern well, and also you also confirm back. Do you have any other concern? Okay, so I think it's good. Okay, so generally that would be the discussion and also the session for tonight. Anyone have any question, including Katigun? I think no question, right? Everyone is okay, yeah. So with that, we will end the session. I understand that com skill is something. The reason why I don't want to do so many com skill is because I feel the again, regardless of how the scenario changes in terms of different procedure or different type of setting, the team is generally the same. So I would advise everyone who are going for the next diet or even registering for the diet 3 is to continue to practice this team again and again. You can practice with the same scenario or you can just modify it and then you can practice among your friends because it's important for you to know how do you speak and the way you speak. Sometimes your friend can actually correct you and try to see because by correcting each other then you will know what is the best way. Because some skill other than keep on practicing there's no way lah. There's no way to really suddenly you become a very pro in com skill if you haven't done that and then suddenly in exam you are expected to be pro. It's very difficult. So it's good if you can practice it in a daily routine. For example, let's say you encounter family members want to break the bad news, and somehow their English speaking language, then you can use something similar. I still remember before when prepare my exam, a lot of times I have using the same approach. I feel that it's really workable, but generally I don't limit myself to like 10 minutes or like 20 minutes. I just give myself some time to try to use different approach and then it works. It really works and then you will feel more confident when you speak as in the exam. I can see Cardigan have probably have practiced a few times or probably continuously being practiced because when from the way he convey and from the way he do the station I can know that he is very smooth. Okay, but again exam is not just about getting the right answer or getting all the points there. It's also about the soft skill component that we need to highlight. We need to make sure that to actually prove ourselves that we are someone that is caring and we are someone that is understandable. I think that also matters as well in the exam as in the examiner point of view. Okay, so with that I think